So the concern is that virus strains that have changed to make themselves so that they're not covered by the vaccine could outstrip our ability to get people immunized. And so that is a concern because if you had a strain that would still cause disease in people who'd gotten the vaccines, then you'd have the the problem all over again, essentially. That has luckily not been a big problem here. And in fact, I think in Europe that is not really a problem to the extent that it's talked about. The problem in Europe really has been more that they haven't been able to vaccinate people in time at all, and shortages and supply problems and other concerns with the vaccines that they have available. Many of the strains that have evolved, such as the one in Britain, and even the one in South Africa that people are very concerned about, the one in the UK, which is circulating in the US, seems to be well protected against by the vaccines. The one that evolved in South Africa and possibly in Brazil may not be protected against by the vaccine quite as well, but even there we think that there's probably protection against severe cases and death. So if we can get everybody vaccinated, then we should be in good shape. And I don't think, at the rate we're going, I don't think that we're going to have a big, the variants outstripping our ability to immunize. Well, it depends how you define a side effect. The number of people who have pain at the site of injection is very high. If somebody sticks a needle in your arm, it's going to hurt to some degree. So the incidence of people reporting pain at the injection site, for example, is very high. Probably the majority of people will experience some pain at the injection site. The incidence of serious adverse effects is far less than 1%. And some people have reported side effects, more side effects after their second shot, which is perhaps not surprising because you've been sort of sensitized to it, so your body's reacting. But I'm not sure that that's really true. Some people have a little bit more side effects with the first one. I don't think we have enough actual data. But I want to emphasize one thing. You hear about this a lot, but the overall incidence of serious effects, meaning something that puts you in bed, is very low. And second, virtually all of the side effects are uncomplicated and people recover within a day or two and are completely without any problem after that, as is the case with most vaccines.
I think at this point of the pandemic, what we want is to get everybody on board and vaccinated as soon as possible. So I think the message is if you get offered the vaccine, you should take it. And I would frame that in two fronts. One is the individual protection that you get from the vaccine. I think that's important to reassure that individual that the vaccine is efficacious, is also safe, but also the community benefit of getting the vaccine on time. I think if we cut the transmission of the COVID virus being protected with vaccine-induced immunity, that's beneficial for the society. And then we're going to get quicker, faster to protecting the whole community. So I think I will not delay vaccination at this point. We have some specific populations that we are recommended, individualized recommendations based on the risk factors and the immunosuppressions. But besides that, everybody in the community should get the vaccine as soon as possible, as soon as he gets offered. I think Dr. Swaminathan was talking about the variants, and the way to cut the developing of variants is to get vaccinated as soon as possible, because there is no way for the COVID virus to become mutant if there is no replication. And the way to stop the replication of the virus, the way to cut the transmission, is getting vaccinated. So that will be the consistent message for everybody. If you get the vaccine like offered to you, please make the appointment, make the arrangements, and get it as soon as possible. Ask the million-dollar question right now, correct? We don't know yet. I think we're getting close to gather data from Pfizer and Moderna soon for the 1 year enrollment of the people who were vaccinated at this time in 2020. And I think that will be very informative, that data from the clinical study that led to the approval of these two vaccines. At this point, we know one thing is the vaccine-induced immunity probably lasts longer than the immunity obtained by infection by COVID-19. Like, in other words, if you get infected with the virus, you have some protection like after that, but after some period of time, some people say 3 months, 4 months, those titers of antibodies go down and the patient becomes susceptible to reinfection with other variants or even with the same one. The vaccine-induced immunity supposedly lasts longer, and we have some data about that. Now, how long does it last? We don't know yet. I think it will. We should gather that data in clinical studies in the near future, and it's still debatable in the medical community, in the scientific community, if this is going to become once per year vaccination. He will going to need a booster depending on the clinical situation of the patient, or I actually believe if we get faster to vaccinate like 70%, 75, like 80% of the community, we may not need that if we can decrease the transmission of the virus fast. So still we don't know. I think the important thing right now at this point of the pandemic, now that we have a positive downtrend in the number of cases, is to get the vaccine as soon as possible. I think those pieces of information about how long that protection lasts is going to come later.
You know, the CDC is saying that you can relax some of your restrictions if you're in a completely vaccinated group. So in a way, that's similar to what you are allowed to do, which is with your immediate family that you are already living with, your level of risk is all the same. If you're all taking the same precautions and so on. So we didn't wear masks with our immediate family in the home, and if you now have friends who are fully vaccinated and appropriate period of time after their vaccination, then they're at the same level of risk as you, and it should be safe to mingle with them in a small group in your house, for example. But if you're going to be having contact with anybody who's not vaccinated or who's at high risk, even if they're vaccinated, like transplant recipients, cancer patients, other people who are very vulnerable, there is still, and we don't know how much of a chance, there's still a chance that you might be able to transmit it even though you're not going to get sick. We think that the likelihood that you can be infected and not sick after you've been vaccinated is probably lower. That is, it's called asymptomatic infection, right? Infection without symptoms, where you're still shedding the virus. We think that chance of that is lower, but we don't know that it's zero. So if you're going to, be in contact with vulnerable populations, then you may want to take the same precautions as you would otherwise, as far as distancing and masking and so on. And it's still not recommended that you indulge in high-risk behavior because nothing is 100%, and there are variants, and just because you're vaccinated, with the level of transmission that we're having right now, I would not be going to a bar, for example, or a restaurant with large numbers of people and operating at high capacity. I wouldn't say that that means it's working, because it's working, whether you have side effects or not. The fact that you have side effects just means that your body's immune system is recognizing something foreign and saying, hey, look, we have to get rid of this, or we have to figure out how to deal with this. And so as the vaccine is exposing your body to something that looks like the virus, and the body is learning how to recognize and mount defenses against that virus, a lot of times the cells that do that will also release molecules that cause both local effects like swelling or redness, pain, but it can also cause systemic effects. That is, these molecules that are released by the cells that are, alerted to this danger, then send out these molecules into the bloodstream, and they have effects such as causing a fever or a headache or muscle aches. And so I guess I would say that that's a not uncommon consequence of your body having an immune response to something. Just like you get fever and headache when you get a bad cold or the flu.
We have data coming from the clinical trials that led to the approval of the two vaccines, Pfizer and Moderna, and actually now Johnson & Johnson, about the efficacy and also safety of the vaccine in a significant number of population. I think in summary, about 80,000 patients participating in those 3 clinical trials. Now, real-life experience with the vaccine has already been published in some countries, and what they have shown is right after the implementation of the vaccine, the first dose, and then more after the second dose, countries have seen a significant decline in the number of infections, the number of asymptomatic infections, and then more importantly, the number of hospitalizations and deaths related with COVID-19. So we have real-life data pointing the benefit of vaccination in large healthcare systems and countries. Now, the question before was about the durability of those antibody titers or the protection created by the vaccine. I think that question is still there. We should be seeing data about the durability of that protection in the following months. But the impact of the vaccine in terms of the stressing or decreasing the stress in the healthcare system, the number of cases, mortality is significant, and we see that, and obviously it's data that is very, very welcome and encouraging too.
With any vaccine, all the vaccines that we have, we only know how long it lasts after we know how long it lasts, okay? So it takes 10 years to know whether something works for 10 years. It takes 20 years to know whether something works for 20 years, okay? And the reason that we know that poliovirus works for as long as it does and when you need a booster is because it's been, almost 70 years or so that we've had this vaccine. So this is a question that can't be answered for any vaccine. We can only know as we go along. If 5 years from now people get COVID again who've been vaccinated, then we'll know. If they start getting it again in a year, then we'll know that you need a booster in a year. But there's no vaccine for which we can predict the future like that.
People who get vaccinated, who refuse the vaccine, is still capable of transmitting the virus, and they are the ones who are going to sustain this infection for longer periods of time in the community. So those individuals should not engage in community activities of high risk, because they are the ones that are at risk of transmitting the virus and also getting sick. I think if you get the vaccine and we get the disease under control, more and more we're going to see going into the summer and going into the fall that we're going to have some liberalization of the measures. We can maybe go to a baseball game. We can maybe have some more like outdoors activities. But like only the trend in the number of cases and the like uptake of the vaccine will tell us if that's possible. But I want to like emphasize that is really one is the like individual protection, but also is the community benefit of getting vaccinated. So I think you should have very strong reasons to refuse a COVID vaccine at this point.
Anyone can go to a public gathering if they observe the precautions, are distance, it's outside, they're masked, for example. But if you're talking, I mean, so even if you're not vaccinated for whatever reason, you haven't been offered it yet or whatever, you can participate in gatherings according to the recommendations. Now, if you're and the recommendations are different for people who've been vaccinated or not vaccinated. So the kind of gatherings that you can do without a mask, we talked about, are small ones with other people who are also vaccinated indoors. And so I think whether you're vaccinated or not, you shouldn't go to a movie theater and just sit there without a mask. I think it makes it harder to achieve herd immunity. This is sort of a different situation from diseases that were primarily spread by children, let's say measles, or where the adults were immune and the children had high rates of disease and sickness and so on. And then you could immunize all the children and you'd get 90% of the people who are susceptible. Now, I think you've got a situation where the vaccine has been tested in adults who are the ones at risk, but the children can still spread it. I think the reason that we'll be able to achieve functional herd immunity by immunizing the majority of adults even before the vaccine gets approved for children, and I should mention that the studies have begun in children, is that small children anyway, young children, are not primary vectors of spread in the community. Children don't go out. The only time they interact with a lot of people is in schools, and those schools themselves don't seem to be major centers of transmission. And the adults there are all going to be vaccinated soon, the teachers and so on. So children are a minority of the population. They tend not to be major vectors of spread. And they also tend not to get very sick or die from the disease. So if we can get, 70% of the adults immunized, we'll have very low spread in this country. We may even be able to eradicate transmission altogether, because once you get to a certain point, the number of cases will have to start going down because there's nobody for me to infect even if I get it, okay? But if you're not below that, if you're not above that threshold of immunity, then I can always find another person to infect, and the disease will keep spreading. One problem is that relaxing restrictions should really be based on risk level. If we were at a point where there was no spread and your risk of getting COVID from going to the grocery store was very low, it would be appropriate to relax those restrictions. I worry about restrictions that are lifted that are not based on declining numbers and declining risk. That, to me, is just, regardless of what state it's in, is not scientific, it's not rational, and it's bound to lead to bad outcomes. You don't decide whether or not to take an umbrella if you just go, well, I've decided that it's March and it's not supposed to rain in March, so I'm not going to take an umbrella. Then you're going to get wet, okay? If you look at the weather forecast and you decide whether to take an umbrella based on the risk, then you're less likely to get wet. It's that simple. Okay. The second thing is, I think that if you go and look now in Salt Lake, you'll find that there's almost universal mask compliance in stores. And I used to not go to certain stores because I was sure that I would see people there who would put me at risk. Okay, some of the big stores. And, you know, there was nothing that the people who worked there could do. People who are earning, you know, $10 an hour aren't going to risk getting into a fight with some recalcitrant person who refuses to wear a mask. So I think it makes people who work in restaurants and retail, and these are the people at high risk, it puts them in a very, very difficult position if they don't have the backing of the state and the police and the government. They have been FDA approved for emergency use because this is an emergency. And they, I think, will be, have formal final approval once they've reviewed all the data from the millions of people who've now received these vaccines.